Hello, everybody. Good morning. My name is Ben Cornwell, a chair and professor of sociology at Cornell University, and I'm delighted to be part of the annual Duke University's Networks and Health Conference. And thank you, Jim, for inviting me. Some of you may know or may not know that Jim was my advisor many, many years ago. I would say, what was it, 2 decades ago. At Ohio State when I was a very young master's student. Jim asked me to talk about some of my recent work on networks and how it relates to health, and I have been doing some recent work relating to the National Social Life Health and Aging Project, which is a project based out of the University of Chicago that is nationally representative and focuses on health and mortality among older adults in particular within the United States. And the project I've decided to talk about today, there were several things I could have talked about. The one I decided to talk about today has to do with very close connections that partners have to each other and the effect that might have on their mortality as they, especially among older adults. And you lose a partner and it can be a very traumatic experience. And there's this sort of finding that everyone knows about and talks about that has to do with the fact that when an older person loses their spouse, they tend to die very quickly. In rapid succession after they lose their spouse or partner. And this has always fascinated me. It's very poignant and sad and something that is scientifically interesting. And the explanations for this have been largely physical in nature, having to do with medical reasons and psychological reasons. And I have always thought that there are probably social structural reasons. So this project is an attempt to look into that a little bit. I'm going to share my screen and get into the presentation. And it's called I Love You to Death. And it's a presentation that I am co-authoring with a graduate student of mine here at Cornell named Chinyao Q. So let me talk a little bit about the motivation for this. Let's step back a little bit from this and tell you how we came up with this idea and why we're doing it. And then we'll get into our analytic approach and our findings. So as some of you may know, my background is largely in the area of health and social networks. And some of my recent work has focused on changes in networks and health. And if you start thinking about the kinds of changes that happen in some of these social networks, obviously, if you're thinking about later life, the changes that are most important have to do largely with loss and widowhood. And this starts to happen pretty quickly after you move past 60s and 70s. And coming out of this thicket is this concept of what I've learned is called the widowhood effect. And the widowhood effect is that idea that once your partner or spouse dies, you tend to die within the next couple of years. And this is it's pretty common, especially among men, and we'll get into the gender thing later. So as a social networks researcher, I've come to wonder whether this has a connection to the couple's social networks and how those are connected to each other, as opposed to just the common explanations which have to do with health, sort of a physiological response to one a partner's death, and or psychological responses. And there are a couple of very well-known explanations for this. So why do people die in rapid succession when their partner dies? One explanation is what is known as the broken heart syndrome, or Takotsubo syndrome. And this is the idea that is when your partner dies, your body is flooded with these stress hormones that sort of overwhelm the organs, and this is it's it's a type of cardiomyopathy, and it's almost unavoidable. So for some people, they get so stressed out by it that they just die because their bodies can't deal with it. The widowhood effect has other explanations, though. There are, and this is what leads me to this project. There's the idea of depression, which starts to hint at some social effects, and anxiety that comes with the loss of a spouse. People having accidents, just tripping over things, just not paying attention to things, and falling down stairs and things like that when in the heat of the moment, and then inflammation. Then you get into this. This is where the social structural aspect comes in. Couples have very closely shared physical environments, not just social. Let's start with physical. And you can start to think about people who are married and have been married for a long time, obviously have been living in the same neighborhood for a long time, and also have access to the same exact hospitals and the same refrigerator and the same grocery stores and so on, and the same pollution, and so it's not that surprising to some extent that couples would experience very similar mortality risk. So when one person dies, the next person dies partly because they've had the same exposures for the same exposures for 30, 40, 50 years. There's also, we get in more now into networks, homophily, and selection. People are drawn to people who are like themselves, and so this redoubles the physical overlap. They're probably connected to people who are grew up in the same neighborhood and are going to the same school and so on. And this also ties into, this is where we get into social networks. The couples shared social environments. They have the same peer effects. They often, after time, the same peer effects. So let's get into that. Peer effects in close partners come from a couple of different places. And if we think about this widowhood effect, the fact that people die, couples die in rapid succession, if we think about that as being connected to the social relationship between partners, then you start to see some very close, obvious connections to social systems, and this is where early social network theory comes into play. Now, the earliest, I want to go back a little bit. The earliest person we can bring in here is Liz Bott. I think it was 1957. Liz Bott wrote a book called Family and Social Network, or Family Social Networks. And what she argued in this book, it's foundational for many social networks researchers tend to be very familiar with this book. What she argued is that people who grew up around, who are connected, partners in particular, who are connected to the same neighbors, friends, and family members, and have the same basic relationships. In other words, they're structurally equivalent. Think about it that way. Partners who are structurally equivalent have more stringent role divisions of labor, more stringent conjugal roles. And this is, we're talking about the 50s and 60s. And the idea behind this is that this means that they have a group of people behind them who are connecting to the same basic social norms and preach the same social norms, and therefore enforce informal social control in a more effective way than partners who do not have highly overlapping networks. So Liz Bott was kind of the first person who came in and said that, look, if you want to understand outcomes with people who are married, just some kind of outcome, like, for example, how stringent is their household division of labor, then you need to look at their social network. Now, this has led to some very interesting work on what is now called dyadic withdrawal. And this is a more dynamic concept, which is the idea that over time, couples networks tend to overlap more and more as the years go by. So you tend to shed ties that were sort of your own tie, that you get together with somebody, you get married to somebody, and over time, as time goes by, you're just more connected to your partner's network, and you lose ties to people who your partner doesn't know. It's a very, very common pattern, and it just happens. And so you get a lot of triadic closure over time. And then this leads to, there's some evidence, the first sociological evidence I've found that ties this into the widowhood effect that I was talking about earlier is Felix Elward and Nicholas Christakis's paper in 2008 on how division of labor between partners relates to the widowhood effect. And what they found is that the greater the division of household labor between partners, the more likely you are to see this widowhood effect. It's really interesting. So the question is sort of open now about how network structure relates to this very interesting and very important effect, the mortality effect. So my question here, as I will move into my presentation, is this a signal that there's something about the level of connection between partners' networks, the level of overlap between their networks, does that play a role in the widowhood effect? So does the division of labor, based on what Bott was saying, 70 years ago or whatever, does that suggest that maybe it's actually about couples' networks, that this division of household labor is really tied back to the effect of that on mortality, is tied back to a network effect? So let me invite you to start thinking about a couple of different approaches, different scenarios. On the left, you see a network where there is high spousal network embeddedness. Now, this is a case in the left panel where we have two spouses who are highly connected to the same people. and they have the same connection to those people. So this is a highly embedded network. You have ego, and they have network ties, and spouse has, ego reports that spouse has the same network ties. In the right panel, panel B, we have the opposite scenario where ego has a number of ties and spouse is not connected to any of them. So presumably, even though we just have one person, ego's report, presumably there's very low overlap between those networks. Let me just go back. So the hypothesis here is that in the left panel, panel A, it's actually a question. It could go either way, right? In the left panel, is that person, is ego and this person more likely to experience the widowhood effect quickly because they're so tightly connected to the spouse that their social environments are interlinked? Or on the right-hand side, is ego on that side more likely to experience the widowhood effect more quickly because they're unconnected? And there are multiple reasons to expect different outcomes. Let me yeah, so we'll get to that in a second. The data that I'll use to get into this is the National Social Life Health and Aging Project, or the NSHAP project. I'm a co-investigator on this project, and that should say 3 waves, not 2 waves. And we have multiple waves of data on respondents who have been older adults starting at the age of 57 in 2005. And what we're going to do is we're going to focus on the people who were there at the very beginning just to maximize our sample. And we're going to look at, since 2005, has their spouse died, and have they died, and what are their network connections to each other? And you can see, I should say 3005. And you can see we have good response rates, and it's good high quality nationally representative data. So what we'll be looking at here is whether the respondent is alive, whether the partner is alive, and just looking at the information that I have. We have a roughly, I think it's over time, roughly 87, it's 18% of respondents who hold on just a second. So what we have at by round 3 of our data collection is that 17%, a non-trivial number of our respondents, had died by round 3. And this is out of roughly 1,100 people who had made it to round 3 to begin with. And 10% of their spouses had, 10% of them had a spouse who had died by round 2. So this gives us information that we can use to do a panel analysis of how the death of a spouse affects mortality. So Um, what we're going to do is we're going to use the main goal is to look at how the mortality of partner affects spouse, but the key question, and so we're going to predict mortality, hazard of mortality between waves 1 and 3 at each wave, and we're going to use partner death as a predictor, starting with people whose partners had not yet died at wave 1 and who were still alive, obviously, at wave 1. And we're going to use the typical predictors you would expect. We have SES, gender, work status, health, alcohol, cigarettes, social support, your basic sociodemographic characteristics, also some social network controls like the size of the network, how many network confidants they reported, social support. And then what we're going to do is we're going to see whether the death of a network member and its effect, quote unquote, on partner mortality is related in some ways to the degree to which that partner is embedded in ego's network. So how much you could call it overlap or you call it embeddedness. And the competing hypotheses are as follows. One, you could argue that losing a partner, this was actually my starting point, losing a partner who's very well embedded in your own network is going to have a more devastating impact on you, and is therefore more likely to lead to this widowhood effect than losing somebody who's not. The competing hypothesis is in some ways more interesting, and this occurred to me as I started writing about it and talking about it with Chen Yao, and this is the idea that actually, you know what, you lose somebody who's not well connected to you, that's a bigger loss in some way. Not somebody who's not well connected to your network. And just think about that for a second, because if you draw on the work of people like Ron Bird or Granovetter or some others, you lose somebody who's not well connected to you, you lose non-redundant ties. And that, therefore, according to the theories that have been discussed in network science over the last few years, that in turn leads to a situation where you are now disconnected from clusters that gave you things that you didn't have otherwise. And furthermore, so you're possibly losing resources that you didn't have. And furthermore, you are now in trouble. When your partner dies, you have a challenge ahead of you because you have to coordinate this funeral and other things with people that you don't know. It's just a bigger challenge. So there's a question, which is true? So there's 84% of people have died. And then here's what we did. We did Cox proportional hazard models for time to death between 2005 2016. And you can look at these, interpret them, and the main interpretation, what I take away, and then one thing I want to say here is that these are pretty marginal effects, and even though they're significant, and consistently significant across models for model 2. What they suggest is that there's a pretty big and high magnitude relationship between whether your spouse dies and whether you die, and how long it takes for you to die. And so, for example, if you take model 1, 60%, 64% greater likelihood of dying at a given time if your spouse has died. Of you dying by round 3 if your spouse has died by round 2. And that's a big effect. And I won't go into models 3, 4, and 5, but they are consistent, and controls are basically consistent as well. So these are pretty good models, but as I said, we're not dealing with a ton of people here, but there's a signal that interests me. And it makes me think, look, in general, that the widowhood effect is supported based on these data. Now, the more important findings relating to my theory, our theory, are presented in table 3. And I'm happy to circulate the tables. But what we did was this interaction, as you can see, between partner embeddedness and whether the spouse died at round 2. And what we see is it's actually a pretty strong in terms of magnitude, but not highly significant, still significant, but not highly significant relationship. Again, like I said, a signal that suggests that what happens is when your spouse, if your spouse is well embedded in your network, then your mortality risk increases to a significant extent. In other words, that look at it, if rather, to put it another way, sorry, to reverse that, if your spouse is poorly embedded, and you could see based on the 0 rather, if your spouse is poorly embedded in your network, then that amplifies your mortality risk. And what that means is that, to step back a little bit from it, it's more of a Ron Burt story or a Granovetter kind of story, that these are people who are losing somebody who is not well connected to their own network, which means that they're probably means that they're losing poorly embedded network members who are non-redundant resources. And I don't want to put it in too much of a capital sense, but it means that they're losing somebody who's not well connected. And these are just controls. These are Kaplan-Meier survival curves. This is just to reiterate the earlier story that the widowhood effect matters. And you can see partner mortality leads to lower risk of survival over time. And this is the difference in the Kaplan-Meier curve between the two groups. So people whose partners were alive versus partners who had died, and how that relates to partner frequency of contact. And so on the right-hand side, you see people whose partners had died and were very poorly connected to their networks, had very little interaction. And you can see the likelihood, the risk of mortality is risk of rather the likelihood of survival is much lower among those people than it is among people whose partners were still alive. And so this suggests that partner embeddedness in the network has some kind of very close relationship, a very significant relationship with mortality, and that depends on whether the partner is alive and what their embeddedness was in the network. This is another way of showing the same thing. This shows number of survival years since 2005, and you can see this really doesn't differ that much when the spouse is alive, whether they interact close frequently or not frequently. But when the partner dies, the bottom just drops out falls out for people whose partners died and their partners had very low interaction with their network members, which suggests again that likelihood of survival is very low for people whose partners have died and who were not well connected to their network members. And again, it's just a signal. It's a 1-star signal, but it's something. I mean, to me, I look at this and I see something that needs to be written about. So some basic conclusions. One thing is that I'll just say that the NSHAP data tend to suggest that the widowhood effect is real, that we see evidence of this in a nationally representative sample. Not a lot of the data on the widowhood effect is nationally representative. We also see some evidence that the effect appears to be stronger among those whose spouses' networks did not overlap much with their own network. And there's several explanations. And one is, as I said earlier, you have a spouse, they die, and that's stressful. I mean, there's the broken heart syndrome effect. There's the sort of flooding your organs with stress hormones. There's also the structural difficulty, the logistical rather difficulty of trying to figure out how to get these people to a funeral and talking with people you don't really know and navigating all that and challenge of that. There's if you draw from Liz Bott's work, there's the idea that you lose somebody who was carrying a load that you couldn't carry. And that means you've ended a very complex division of labor within your household that otherwise wouldn't have existed without this person, and now that's gone. And there's the Ron Burt story that what you've lost is non-redundant ties and resources. I think moving forward, as we talk about this, there are obviously some limitations to this project and also some directions for future research. And one is to talk about linked lives, and this is a growing topic in sociology. There's a lot of endogeneity here. You know, people misreport things and they read into connections that don't exist between their network members, and things like that is a common problem with egocentric network analysis and survey research, although the subjective, approach is very important for getting information that we otherwise wouldn't get. There are some interesting things to look at here. There's a lot of good work to be done on how mortality risk relates to other aspects of one social network. The widowhood effect is a part of speaks to a very specific part of one's network, but you could think about also about the connections one has to one's children and good friends, and how do the connections that they have to your network affect things. And then there's a lot of things relating to inequality, heterogeneity, homophily, bridging ties, and how the effects of one's network might relate to the diversity that exists within one's network. And so maybe network effects stronger when your network is homogeneous versus not. I don't know. And then to step back a little bit, how does this all relate to other aspects of one's social environment? And so if you see something relating to network turnover, partner dying, for example, could be some reflection, as I said earlier, of the fact that these partners shared a very disadvantageous social environment, that they were exposed to the same level of pollution or level of turnover, evictions, and things that destabilize their networks. So there's a lot of network and context overlap stuff that needs to be looked at. I'll just end there, and I think it's about time. And so thank you so much for listening to my talk, and sorry it was a little broken up, and it would be a lot easier to do this in person, but I actually, this is something that I've been wanting to study for a long time, and this paper is underway. We haven't published it yet. Danielle and I are still working on revisions, and if you have comments about it, please do send them our way, and we will implement them. And I'll just say I'm very happy to have been able to have been invited to present this work, even though it's not finished. And thank you again, Jem, for giving me the invitation. And I hope you've enjoyed the Duke University Networks on Health conference, the workshop. And I'll look forward to our Q&A session. Goodbye.